Good morning, one and all. Firstly, at the outset, I would like to thank the organizers for inviting, especially Dr. Vikas Wotswal, for making me part of these deliberations. And I also take this opportunity to congratulate the founders of ISCC and organizers of this wonderful conference filled with several scientific deliberations over the period of next 2 days. And I wish them all the success. As it is rightly said just now by Dr. Doval, cancer patients are certainly susceptible to malnutrition. Firstly, because of the impact of cancer process itself, and secondly, due to the impact of treatment. So that means right from the stage of diagnosis, the patients will be requiring nutritional intervention and nutritional care. So there is quite a good possibility of appropriately planned, individualized nutritional strategies to correct the existing nutritional problems and also to prevent malnutrition that may arise during the course of treatment. Through this process, it is possible to achieve good nutritional status of the patients and also to maintain the same throughout the treatment and thereby to support the anti-cancer therapy, which is definitely one of the most important goals of nutritional care process. But however, reaching this goal is not very easy for dietitians. There are many hindrances and many challenges the nutritionists may have to face, and among them, one of the most important challenges is mucositis. As we all know, mucositis is nothing but the inflammation which is very painful due to ulceration of the mucosal membranes throughout the GI tract, right from mouth to the anus. And the various complications in the pathogenesis of mucositis all will cause problems with food consumption of the patient and also digestion of the food that has been consumed, and overall thereby leading to malnutrition along with dehydration, and together this will interrupt the efficacy of cancer treatment and ultimately it will affect quality of life of the patient. And hence it is very necessary to modify the diet plans that are made or dietary strategies that are developed by the nutritionists to suit the patient suffering from mucositis. So whatever guidelines that we are going to discuss henceforth are actually the modifications or guidelines over and above the typical cancer diet that has been planned based on the scientific evidence available to the dietitians and also individualized. So these are not the basic principles of cancer diet. So those, I consider that the basic principles of cancer diet have been followed, and then over and above whatever guidelines have been suggested in the light of scientific evidence I am going to discuss during my talk. Looking at the higher incidence of mucositis, it becomes imperative to look into nutritional strategies very carefully, and the possibility of mucositis is higher when the radiation and chemotherapy are given together to the patients. Now, before planning any nutritional strategies, as a very important step in nutritional care process, assessment of the patient is very necessary, and I am not going to deliberate on the various regular nutritional assessment procedures that the dietitians have to follow in order to develop an effective nutritional plan. Okay, over and above, it is very important to understand the severity of mucositis, and as per WHO's criteria, when you look at the various degrees into which the mucositis severity has been described, from 3rd degree and 4th degree onwards, specialized modifications in the diet need to be made, and in the 3rd degree more importance is given to mostly the textural or consistency of the diet, whereas in the 4th degree probably the patients would be requiring special nutritional support. And somewhat similar guidelines are also given by National Cancer Institute, and wherein little bit differently the severity has been explained, and here right from grade 2 to grade 4 increasing importance is given to nutritional modifications, and this is also calling for more modifications with regard to consistency and fluid content of the diet. There are several multi-targeted treatment modalities that have been followed and which we can consider as tips to implement our nutritional plans. To begin with the cryotherapy, wherein holding ice cubes in the mouth before, during and just after the chemotherapy has been found to be effective. But however, it may be difficult for patients with severe oral mucositis to hold the ice cubes in the mouth. Then it is followed by very important tip, that is maintenance of oral hygiene. This would certainly improve the taste sensations of the patients so that they will be able to accept the food that is served to them, and while stimulating their appetite to consume the food. Because in cancer patients, loss of appetite is one of the most important problems that all the nutritionists and dietitians would face. And use of ozonated water, that is found to be very useful for these patients because it is antimicrobial and also it is analgesic. And using bicarbonate rinses in this concentration would also facilitate food consumption by reducing the acidity in the stomach. And along with that, several other modalities have also been suggested. There are evidence-based clinical guidelines proposed by MASCC way back in 2004, where there are 5 points that have been importantly focused in their systematic review. And I feel if we look into the therapeutic benefits of phytochemical constituents of various foods, probably we will be able to find multiple possibilities of nutritional interventions at each of these stages. So every stage we will be able to support the medical therapy through some dietary strategy or the other. As per the SPN guidelines, it is very important to formulate individualized nutritional counseling during radiotherapy. This is very important to prevent nutritional deterioration, at the same time maintaining the nutritional status and avoid RT interruptions. So based on these guidelines, 3 goals can be identified for the nutritional support. And the first and foremost goal, which has come very strongly across the evidence-based information, is to maintain the adequate hydration status in the patient. So which calls for the entire day's menu to be more of semi-solid to liquid consistency and incorporation of more and more liquids in the diet. And this will be followed by providing all the nutrients in the required amounts as it is decided following the individual strategies, but providing these nutrients through foods which are non-irritating to the patient, and at the same time the overall food consumption capacity of the patient might be lesser, might be compromised because of the side effects. So it is very important to make each meal nutri-dense, at the same time non-irritating foods. And of course, as and when it is required, the patient has to be suggested the special nutritional support of enteral or parenteral nutrition as and how it is decided by the doctors. So there are several systematic reviews and meta-analysis reports that have come through, which have discussed about the nutritional guidelines for patients suffering from mucositis. I try to stick to the latest documentations. So here there isn't much discussed about the overall energy consumption, and all the dietitians would know that the best way to decide the energy requirements is trying to balance the energy consumption with energy expenditure. So as and where it is possible, either using the activity records or using the indirect calorimetry, if it is possible, that is considered to be the best method. Otherwise, the energy requirement which is often suggested for a sedentary activity individual has been suggested for cancer patients as well. But what has come across very strongly with regard to macronutrients is high protein recommendation for the patients, ranging from 1 gram to 1.5 gram depending upon the current existing protein nutritional status of the patient, that is body protein content of the patient. So understanding the body composition of the patient also is very, very important to decide on protein quantity of the diet. And distribution of the protein throughout the meal is another very important aspect, and that would facilitate assimilation of the easy assimilation of the protein in the diet. Then there aren't clear-cut guidelines about micronutrient needs of these patients. However, it is said that as and when a clinical symptom related to a particular deficiency of a micronutrient is seen, then correcting that through nutritional supplements is very important. However, there is a caution that has been given, that is not to overdo with micronutrient supplements, especially the ones which are antioxidants and immunonutrients. So it needs to be, the decision needs to be taken individually with regard to immunonutrition as well as antioxidant nutritional supplements. And as I have already put forth initially, adequate fluid intake is very, very important, and it is nice to know that some of the foods that are commonly available can be explored for their therapeutic properties, like for example the papaya juice. So which is considered to be a salivary stimulant and very mild juice, and it is a non-irritant as well. So that would have been a better choice. So like that, it is very important to identify the foods which are non-irritant, at the same time which can be provided in that particular form which will impress the patients to consume the food, which is very important. Then energizing each and every food in order to provide good amount of energy within the foods that are accepted by the patient is important. So even the soups and semi-solid liquid foods can be enriched with protein. So the protein shouldn't be concentrated in major meals. Actually, the concept of major meals probably should be re-looked into in order to provide more and more small and frequent meals to the patients. And restriction of known irritants. Here again, I feel that you need to go by the patient's personal experience, because it may vary between patient to patient, and there are certain known irritants to the oral mucosa especially, so those need to be avoided. And there are some spices which may not be irritant, because there is a common idea that spices are generally irritants. Not all spices may be irritant to the oral mucosa, so it needs to be incorporated in such a way that the quantity is more important, and the way how it is incorporated, whether you are incorporating while cooking or you are adding the spice post cooking. So this is what is important, because there are many phytochemical constituents in the spices which are anti-inflammatory at a mild level, so which may support the cancer therapy. And avoiding the dry and rough foods is also very important, and temperature of the food and consistency of the food also needs to be looked into. So the foods that are at the body temperature are well tolerated or slightly warmer than body temperature, and of course cool foods are definitely tolerated. Now, improving the saliva production in order to address the xerostomia is also important, and there are certain simple measures to do it. And there are certain foods also that can improve the saliva production in the mouth, so that can be seen. And patients who are suffering from stomatitis may have to be suggested some of the diets that are suitable for patients suffering from gastric reflux. And I cannot close my presentation without talking about certain functional foods which are of course deliberated a lot in the reviews and in the scientific information, and at the same time their benefits cannot be ignored. Among them I have just selected very few of them due to time constraints. And there is lot discussed about essential fatty acids, and every dietitian's attention is when it comes to fat, it is essential fatty acids. And what is worrying here is the type of oils that are used in the cooking, and the omega-6 rich against omega-3. So this disturbed balance and disturbed ratio is considered to be, or is also documented as one of the stronger influencing factors of non-supportive nature of the diet. So it is very important to maintain a balance between the two and meet the requirements of omega-3 and follow the ratio of omega-3 to omega-6 as and how it needs to be followed for a normal, apparently healthy individual. And very interesting piece of information that I have come across is we need not concentrate more on EPA and DHA, that is fish oils, which we generally do for other patients or other apparently healthy populations, whereas the linolenic acid, which is more of vegetarian origin and of course algal origin, so that is considered to be more beneficial in spite of having lesser number of double bonds in it. And though the lipoperoxidation products which originate from omega-3 fatty acid, they are actually supporting the cancer therapy. This is a very interesting piece of information. So it's not necessary to stress on EPA DHA from fish oils for these patients. So need to pay attention to the ratio whenever we are suggesting, and no need to go for higher amounts of any of these essential fatty acids, especially the omega-3. And of course, there is lack of evidence to suggest supplementation of omega-3 to them. So definitely the responsibility falls on the dietitians themselves to see that omega-3 requirements are met, and all the dietitians must be knowing how difficult it is. Okay, then moving on to another very much discussed functional nutrient, that is glutamine. And there are several benefits which all the dietitians and doctors would know certainly, and the dosage is also very well prescribed. But however, in 2016, there is a documentation by ESPEN to suggest mouthwashes, use of mouthwashes with glutamine with this concentration, and also intravenous administration of L-alanine L-glutamine at this concentration, which has found to decrease the incidence, severity and duration of radiation-induced mucositis in HNC, head and neck cancer patients. Whereas the latest documentation by MSCC, for of course HSCT, it is totally contraindicated, whereas in head and neck cancer patient they also found glutamine to be beneficial. But however, no definite guideline has been proposed in this. And then the antioxidants, and I would like you to focus attention only on the combination of antioxidants that are found to be more beneficial, like vitamin C and E. A combination is working well, and there are several mouth washes, rinses or gels containing multiple natural antioxidants. So when the antioxidants are being provided in their natural form, extracted from natural sources, they are found to be better working and without any side effects than the synthetic antioxidants. Of course, there will be more discussion on probiotics during the panel discussion, so I don't want to go talk more about the probiotics, but however, probiotics, the role of probiotics cannot be ignored, and for a patient who has to be on his regular day-to-day diet rather than everything new that is going to be introduced in his diet, it is better to concentrate more on prebiotics and then or symbiotics, because India is very famous for fermented foods and many countries as well. So it is better to concentrate on symbiotics with the required cultures of probiotic organisms. Okay, oral applicants of nutritional constituents are also found to be beneficial, and we cannot ignore the patented spice of our country, turmeric. So the curcumin, the active constituent of turmeric, which is being extensively used in treatment of various diseases including cancer, wherein right from mouthwash to mouth gel to just as a simple additive to day-to-day cooking, it will really do wonders. And honey is another food, functional food, which has been identified to be very useful for cancer patients. And the last sentence I would like to pay you attention, I'd like you to pay attention. Combination of honey and turmeric, combination of honey and aloe vera and coffee. So these combinations are found to be very useful from the point of view of multiple benefits that honey offers, along with the phytochemicals present in the adjuvant. So these are some of the studies that have been published, and of course the benefits of honey probably are based on variety of honey. So we need to look into more trials testing in the honey that is available within our country. So thank you very much for your patient hearing, and I hope I have given you good information on this.